Yes, well, look at me, please, for a moment. Okay. Look, yes, like this. Excuse me, please, I move this. Well, and close your eyes. And open. Well, close once more. Your eyes, yes, and open. Yes, and here like this. One moment. First take here is very positive and trembling of eyelids. Well, like this. Please, excuse me, please. Excuse me. So, he is very sensible, and that is good, because we have plenty of people, they are not sensible. Do like this, please, Peter. Like this. Wow. Fingers like with eyelids. This is 22 for 15 seconds. This means 88 for a minute. Could you close your eyes, please? This is 24 for 15 seconds. This means 24, 48, 96. After pressing of eyelids. Yes. This means, in summary, very clear overexcitability, sensitivity, even cutaneous, excitability of his heart functioning, and, well, fairly strong psychic inhibition, which is, I think, necessary in any positive development. You see that even through neurological examination, we can see something, not too much, but something.
Suffering, aloneness, self-doubt, sadness, inner conflict. These are our feelings that we have not learned to live with, that we have failed to appreciate, that we reject as destructive and completely negative. But in fact, they are symptoms of an expanding consciousness. Dr. Kazimierz Dabrowski has spent 45 years piecing together the complete picture of the growth of the human psyche. From primitive integration at birth, the person with potential for development will experience growth as a loosening of his stable psychic structure, accompanied by symptoms of psychoneurosis. Reality becomes multi-leveled. The choices between higher and lower realms of behavior occupy our thought and mark us as human. Dabrowski calls this process positive disintegration. He declares that psychoneurosis is not an illness, and he insists that development does not come through psychotherapy, but that psychotherapy is automatic when the person is conscious of his development.
In your concept of psychotherapy, you accept the presence of discomfort, pain, and anguish as part of the normal state. Yes. And you do not direct your effort to the abolition of these states of unrest.
Dr. John Gibbs is Director of Clinical Services, Alberta Hospital, Ponoka.
Characterized by a certain unrest.
Yes.
With the discomfort that accompanies it.
Clearly, this means I am against all the principle of elimination of symptoms. For me, this elimination means something surgical in psychiatry. We like very much to be based on, well, on science on concerned body, and we like to any extirpations, any eliminations. And I think that in psychiatry and in education and in development, any eliminations means mostly something negative and bad.
Dabrowski was, of course, brought up in the Freudian school. He was a contemporary, I believe, of Jung's.
Pauline Tippin is a social worker and counselor in Edmonton.
Of psychoanalysis and so on under Steckel, I think it was, Steckel. And, but the difference between Dabrowski and Freud, I think, is tremendous. That whereas Freud would say, for instance, in terms of things like psychoneurosis, maybe guilt, let's get rid of that feeling of guilt. It's a nasty feeling. It's due to something in your childhood and so forth. We'll get rid of it. Problem solving, if you like. Dabrowski would say, let's look at it. Let's utilize it in the growth process.
We always start off now in therapy from a very negative point of view, that here is a poor, suffering person with a lot of very undesirable behaviors.
Dr. Charles Helen is Director of Mental Health Services in the province of Alberta.
At this time, I think it could change that attitude. And if we could reduce that stigma that's attached to illness and reduce that sort of dependency that the patient is taught to have, that he comes to somebody to get his symptoms removed, now he would come to develop with a therapist. I think that this would be would change the psychotherapy very markedly.
This is Alberta Hospital, Ponoka. Here, Dr. Dabrowski has been working to introduce his concepts to the staff and patients alike. To Dabrowski, real therapy is autopsychotherapy. It is the self being aware of the self through a long inner investigation, a mapping of the inner environment. There are no techniques to eliminate symptoms because the symptoms constitute the very psychic richness from which grow an increasing awareness of body, mind, humanity, and cosmos. Dabrowski gives birth to that process if he can. Brian is 17 years old. He came to the hospital 2 months ago, suffering from delirium and persecution characteristics. He jumped from a second-floor window and broke his leg. Brian is introverted, shy, and has few friends. He is good in school, particularly in math and in the arts.
Could you tell me something very briefly about your dominant characteristic traits?
Well, one of my dominant characteristics was I like to work.
Yes.
I like music.
Yes.
I like people. I like talking with people. I like working with people. Now I always enjoyed it out on the farm.
And tell me, are you timid?
Yes.
Yes. Well, could you describe me your attitude of timidity?
Just that timid is being shy.
Yes, yes. And you are shy.
Yeah.
He was always timid, shy, and I repeat, introvert. And he knows this. This is not very deep knowledge. This is first stage of self-knowledge, but after all, sufficient to begin something like autopsychotherapy. And well, I want to add something, Brian. Think about many times, you should at the evening, when you are alone, to think that in relation to all reality or stimuli, you should be controlled by yourself. This means you should look at your inner stimuli and external stimuli, look at them, and to be in some extent independent of such a stimuli. Not act always immediately on the basis of stimulation, external or inner, you know, but well, to have some moments of, how I can say, reflection, and after to do this or another kind of action. This means to be always controlled by yourself. You understand me? And think about, well, even 5 minutes before your sleep about all this. And now, Brian, I want to ask you to play something from your pieces of music. I am glad that you play clarinet, and I think that you should develop very deeply this kind of interest. Could you play something? We try always to do very large, very deep, multidimensional, multi-level psychological and psychiatric diagnosis. with all testing, with neurological examination, psychiatric examination, many tests like my test here and Rorschach and so on. And after such a deep multi-level examination, we introduce each of the patient which is sufficiently cultural to the medias res. This means to the essential problems. This means we try to show them what kind of psychic richness, what kind of creativity, what kind of positive traits they present on the basis of diagnosis. And I think that after accumulation of practical data, they became conscious in relation, lead by lead, conscious in relation to their personality.
He talks about going to the highest, or, you know, join music or some other field that's real hard to get, that you really need to work at. We were working on music all the time that he was here. He's quite interested in music, and since I'm quite interested in music, he likes to hear music. The music kind of gives you a feeling of security. Or music makes you feel good. It helps clear up my mind. It just relaxes me, that's all.
You have this need, very deep need, to be animals from time to time. But if we are people with something like different levels of functions, we observe ourselves and we dislike to be always on the primitive level. This means to be aggressive, to be completely egoistic, to be stupid, to be, well, subordinate, with tendency to subordinate others to our primitive instincts. And this is basis for so-called multi-level aspect of our human being, of our human nature. And you observe this multi-levelness in each human phenomena. This mixture of animality with higher human nature. And if you act as a highly developed human being, we will never go down towards the most primitive aspect of your life. Well, and perhaps last one, very brief.
Without intense and painful introspection and reflection, development is unlikely. Psychoneurotic symptoms should be embraced and transformed into anxieties about human problems of an ever higher order. If psychoneurosis continues to be classified as mental illness, then perhaps it is a sickness better than health.
Well, Dr. Dabrowski always gave me the impression that he was really educated, somebody who was really known all over the place. So he just gave me the impression of being a very high, very intelligent person who can judge people just by looking at them.
Well, I think that I could not understand myself and the development of tendency toward positive disintegration without coming back to early period of my experience. For instance, why I am at the period of puberty, well, I have such a changement in my mood, or why I am ambivalent and ambitent. Why I have feeling of inferiority and superiority without any reason. And why people are explosive at this time without any reason. And I began to speak about this our disintegration between automatic form of our activity and something higher, which could be against this. And this was beginning of something like understanding, not always consciously, understanding of the problem and of disintegration.
We have to understand that Dabrowski...
Dr. Tom Nelson is chairman of the Department of Psychology at the University of Alberta.
...has been uprooted a number of times. Everywhere he's gone, he seems to generate a great deal of excitement and enthusiasm for his ideas. But on the other hand, there have been always external forces that have controlled the development of his ideas, you know. Unstable appointments, political changes, in favor, out of favor, you know, here on a visiting professorship, there in a visiting professorship. And that's not conducive to, you know, making real academic penetration.
I wanted very much to be with mental patients, to know better what is it there. Perhaps they were so intensively emotional and so intensively overexcitable that they could not, how I can say, accept some kind of human reality, and by this, through this reason, they finished by mental disturbances.
Ursula is in a depression that has lasted 10 years.
How are you feeling right now?
I guess guilt, tension, wondering why I get those overwhelming fears that almost paralyze me, and wondering why I would have those fears where there is nothing to fear of. But I have fears of fears.
Right, now you're getting warm. Dr. Dabrowski, do you see a positive aspect to this kind of fear?
No, but I see the possibility of transformation of such states in something much more positive. And this will depend of, how we can say, understanding of this problem from the side of the lady. For instance, if you occupy your emotional life, your thinking with, occupy with others, you will not think so intensively about your depression, your obsessions and so on. If you will develop your social attitude towards other people, you will diminish many of your egocentric states. She was at the state of very deep depression, with sadness, with any believing in herself. Even she presented herself as somebody rigid at this stage. Somebody even with something like isolation from myself and from Dr. Floyd. And at this very difficult stage, I tried to introduce interest in herself for herself. If you are in good theater and you observe, well, dramatis personae, yes, how you could call this, and you see heroical people, they are in very deep depression, sadness, anxiety, but they are heroic. You feel at the same time something like, well, like a very good enthusiastic attitude, and you are at the same time very sad. And this mixture of suffering and of enthusiasm give you possibility to go up to the higher level.
Dr. Dabrowski, how do you distinguish, or do you between the positive aspects of psychoneurosis, as maybe the matrix of creativity, say, and the negative aspects that we identify as being mental dis-ease?
Fairly clearly, and this is question of multi-levelness. If I see, as I told here, about interneurotic and intraneurotic differences in the level of functions, if I can distinguish higher level of functions, I think they are rather positive. Next, I differentiate by the creativity, by the social attitude, by something like clear aspect of self-control and so on, and by many such aspects, I cannot be sure always. I can commit very often errors, but this is something like criterion for curability, transformation, development, and lack of morbidity in special group of psychoneurosis and nervousness or psychic overexcitability. The same in some extent, much more or less in relation to psychosis.
Dr. Dabrowski, there is an inverse or a direct relationship between depths of suffering and potential heights of joy?
Surely. For this reason, I am not completely pessimist. Because, well, the suffering on the highest level will be always suffering. But at the same time, they will give something like enthusiastic factors, like something like understanding globally all other people, like hero in theater and so on. And such a suffering gives something like partial happiness.
I've often thought if someone offered me a magical potion and said if I would give a pill to my children, they would live a life with no suffering, then I think that's the last thing in the world I would do, because their lives would be so insufferably shallow and hollow and flat and empty, like they would have no compassion, they would have no depth. You know.
I am so happy to hear this.
It may be, Ursula, that so often what we see as the greatest curse that causes us the greatest suffering, if we look more deeply, it may be the greatest blessing, and the thing that adds a dimension of depth and a dimension of significance to our lives.
She was rejecting herself, and she was rejecting the contact with us. And little by little you observe, I am sure, that she is going from one level to another.
My question last time, I wasn't unable to answer you because I have had it blocked out of my mind.
And now?
At one time I was able to block things out of my mind.
And now, madam?
It came back. You asked me if I ever have been in contact with the supernatural.
Yes.
I have.
Ah, well. And this was, in my opinion, very good, because you could observe her improvement, her better and better relation toward environment. This is another discovery, madam, small discovery.
It was very scaring, and I blocked it out of my mind.
But do you accept now that that you have very strong potential for development? Do you accept this?
But I don't know if the experience of the supernatural was with me mental or real.
This is another problem.
Because I have lain in bed and have seen my body floating in the ceiling.
They can become real.
I have looked in the mirror and combed my hair and practically thinking of nothing, and would see my eyes changed.
To stabilize more and more this attitude on the highest level. This is difficult, but after all, she shows us that this is possible. If the treatment will be systematic, with deep contact, well, this will come. This was impossible at the beginning to stimulate her smiling. And you observe that after something like deepening of our contacts, her smiling from the rigid one became much more sympathetic, deep, vivid, and contacting with us. Thank you very much. You know that atmosphere here, and all our friends are terribly sympathetic and well, and create a beautiful atmosphere.
In this picture, Ursula reveals her inner orientation. This is a smile born not of a need to impress an external world, but of a sympathy for the world rooted in her own experience. Similarly, each of us reveal to the world the degree to which we are authentic or inauthentic individuals. All our moods, and indeed our approach to life and stage of mental development, can be read in our faces and in our body posture and movement.
Here any clear reflectivity, and we do not see any empathy toward external world, but he expressed something externally.
Dabrowski invites his clients to read people in his faces test. From a collection of photographs, the client chooses those he associates with. There is usually found an agreement between the levels of mental development of the people in the photographs and the person making the choices. Dr. Dabrowski shows us the kinds of insights he gains from a few of the images in his faces test.
Mostly sensual sign, even in his his structure of lips, in his structure of eyes, in his fixation of eyes. I do not see here the concentration on his inner milieu. I do not see here very deep emotional expression, and even I do not see too much of intellectual overexcitability.
And here we have Vincent van Gogh.
I see in his expression very clear and strong tension, very clear anxiety. You see in his eyes and in his mouth something like suffering, clear suffering, anxiety and deep depression. Even he is in some extent lost in his anxiety. I see this in the expression of face. Did you observe your smile in mirror?
Yes, I did.
Yeah, well, I think that 3 years ago this smile was very clearly different. His smile was always directed toward external world, and it is in the same time perhaps much more stronger toward oneself, like something toward his imagination. But in my opinion, this smile was much more sad, much more depressive. Now, I cannot say that your smiling is sad, but partially yes, and partially even also depressive, but with another manner. He is growing very clearly each month and each year towards something like the same type, the same kind of experience, but with much more reflectivity, much more quietness, and much more knowledge about himself.
Peter is 17 years old. 2 years ago, he began seeing a psychologist because he had no friends, was hyperactive in school, and seemed to be an underachiever. Peter was alienated from his environment. His progress since is marked by Dabrowski.
Yes, I'm maturing, is what you're saying.
Maturing, but maturing in a very positive way, I can say. Maturing with very clear mental and even spiritual development. And I see this not only by discussion with you, but I see partially by your movement, by your gesticulation, by your bodily attitude, especially by your psychological expression and smiling. I risk here the affirmation. In my analysis of 200 eminent personality, 95% presented something like anxiety, trouble, anxiety, depression, obsession, infantile neurosis, hysteria, many such symptoms. And by my analysis, I am not sure here, but almost sure, That's well, you can observe in eminent personalities only transformation of suffering, transformation of anxiety, transformation of depression, but not elimination. Such a symptoms will appear on the higher level. For instance, with Michelangelo, he was not, in my opinion, sick, but he had, for instance, agony in relation to sense of life and sense of suffering and sense of death. Chopin, Beethoven, Van Gogh, they are much more mild, they are much more controlled by themselves, but this not means that they not present any depression, any obsession, any anxiety. Even they present perhaps very often even agony.
Be greeted, psychoneurotics, for you see sensitivity in the insensitivity of the world, uncertainty among the world's certainties. For you often feel others as you feel yourselves. For you feel the anxiety of the world and its bottomless narrowness and self-assurance. Be greeted for your phobia of washing your hands of the dirt of the world, for your awkwardness in dealing with practical things, and your practicalness in dealing with unknown things, for your transcendental realism and lack of everyday realism, for your creativity and ecstasy, for your maladjustment to that which is, and adjustment to that which ought to be, for the loneliness and strangeness of your ways. Be greeted.
Without passing through very difficult experience, and even something like psychoneurosis and neurosis, we cannot understand human beings, and we cannot realize our multidimensional and multi-level development toward higher and higher levels.